Okay, good afternoon. My name is Lungwe Stephen. I'm an assistant chief of Lunganyiro Sublocation in Matungu Sub-County. Apart from my administrative roles, I'm also a professional accredited mediator working under the umbrella of the court, and I'm also an M&E specialist. Silent No More is a program that has really caused what we call paradigm shift on general approach to reproductive health, because previously the issue about sexuality and related services was something that was shrouded in a lot of secrecy, and especially our women and young mothers have suffered that silence, and we in the process we have actually lost lives, and some women have been left with debilitating lifelong conditions. However, since the beginning, the introduction of this intervention by Matungu Community Empowerment Network, we have had a tremendous change. The organization, the CBO, had a very good intervention, a very good approach. They began by bringing on board all stakeholders. I remember the initial meetings brought together teachers, religious leaders, imams, and administrators. All community-based stakeholders were brought on board, and they were sensitized accordingly, and we accepted. Most of them adopted the concept and agreed that safe reproductive health actually should be a topic that should be discussed openly and without any stigmatization. So we have had several meetings. We brought together, meaning on board, key functionality of universal health coverage. You remember that is a key pillar of Kenya Kwanza government. And at the primary component of that system is the CHPs. CHPs were brought on board. They were sensitized. And today, as we speak, the issue of reproductive health and safe abortion is no longer secret. CHPs have helped in sensitizing communities and residents about safe abortion. They usually have regular community dialogues where us as Ngao, we attend special chiefs and assistant chiefs, including village elders and Nyumba Kumi, we do attend those meetings. And we sensitize. We jointly sensitize members about the same. So as a result of such meetings, they also, in addition, attend our regular public barazas. You remember that is a requirement of chiefs and assistant chiefs. We are required to conduct at least 2 public barazas in a month and report on the same. So village CHPs and local public health officers attend those meetings. We jointly sensitize people on safe abortions, especially targeting teen mothers. And as a result, we have strengthened community referral system. Women who are caught up in that issue, who are in distress, they can easily reach out to CHPs or village elders, and accordingly they are referred to level 2 and level 3 hospital for specialized care. Today, a number of residents, and nearly all, are no longer embracing backstreet service providers, but instead they have adopted the community referral system, and those who are in distress approach village elders or CHPs, of course with our knowledge, and then we have really strengthened that referral system. They end up getting service, the required service from government accredited service providers. So Masen has really changed so many things. In me as a mediator, I will tell you that previously we have had conflicts. Of course, if somebody, a woman, goes to look for medical service from a backstreet service provider and something goes wrong, when she comes back at home, there will be a lot of conflict arising out of that. But today, you remember in a medical health facility, if abortion has to be procured, the two partners, the entire spouse is brought on board. The two spouses are brought on board, they are cancelled before the process is undertaken. So we are very confident that going forward, if this system is going to be strengthened, Masen is going to be empowered much better to undertake this sensitization so that we can have a system or a society that is well aligned to safe reproductive health. The only area that I feel that will require strengthening is particularly on referral system. Many CHPs and village elders, they may encounter distress at night, and transport becomes a problem. You remember if you are conversant with such cases, you may come across a case that cannot be, such a woman in distress cannot be transported on a motorbike, and it's the only means of transport that is available locally. Our health facilities around do not have ambulance services. The only ambulance service is located in Matungu and is privately owned and serving the entire sub-county and even beyond. So transport is a major problem we are having. Probably another issue would be mainstreaming. I would pray that there is mainstreaming of this intervention so that it becomes part and parcel of the government programs, especially the ministry that is in charge of public health, so that the issue of safe abortion is discussed candidly within the confines of medical service provision. So without much ado, I think that's much I can say. But Masen, I really pray that they continue doing what they are doing. It's a good intervention and we are praying that they get more funding so that they escalate this project even beyond Matungu Sub-County, because we are in contact with our counterparts in these other areas, including Busia County, Bungoma County, and we know the kind of problems that are undergoing, they are facing, especially when it comes to issues of reproductive health, particularly abortion. Thank you.